One of the common questions that we get here when doing webinars, hands-on courses and so forth is, folks will see us place wedges from either the buccal or the lingual, and so they'll ask, well, how do you decide, where do you know where to place the wedge? Do you always wedge from the buccal, always from the lingual? And the answer to that question is pretty simple. If you look down here at the typodont, what you want to do is wedge from the side that has the wider portion of the prep. So we see here on the mesial of this molar, we've got a little bit wider area right here, and that's the side you want to wedge from. And I'm going to put a wedge in there without a matrix band so that you can see why. Okay, so with a matrix band in place, you wouldn't be able to see this, but the wedges, almost all wedges are tapered. Towards the gripping portion of the wedge, they're wider and then they're narrower at the end to facilitate insertion. And you want the widest part of the wedge in the wide area of the prep so that it supports the matrix band. So these happen to be the Garrison 3D Fusion wedges with these soft little rubber fingers on them. But you can see here how nicely that would support the matrix band in that position. Now on the distal, the DO portion of this MOD, it really doesn't matter. You can see here that the prep itself is very well centered on the tooth. There is not a wider or narrower portion here, so it really wouldn't matter. Let's just flip this around so that you can see. I think this will demonstrate it too very nicely. Now you can see that the tip here, because of the thinness of the wedge, there's not much that would be in there to help support this matrix band against the tooth and seal that up. So very important to wedge from the side that's wider, particularly when you get into really big restorations. Let me grab a larger wedge here. Really wide preps, you absolutely have to wedge from the side that's wider so that you've got this nice heavy part of the wedge supporting that matrix band down by the gingiva, able to seal that up nice and tight against the tooth. So there you have it, wedge from the side that's wider.